Welcome to Lance, lectures about nursing concepts and examinations. I'm Lance, your lecturer on this nursing channel. In this video, we will talk about antidepressants. We will cut through the confusion and separate guesswork from mastery. So let me train your brain to develop your nursing exam instincts and to be a nursing ninja in real clinical practice. So let's start with the basics. Antidepressants are indicated for depressive disorders such as major depression and persistent depressive disorders, or dysthymia. It can also be prescribed for anxiety disorders such as general anxiety disorder, panic disorder, social anxiety disorder, obsessive compulsive disorder, PTSD, chronic pain, and neuropathic pain syndromes. Also, it can be used in combination with a mood stabilizer as an adjunctive therapy in bipolar disorder. Always remember that antidepressants treat symptoms and not stressors. Medication alone is not sufficient, and psychosocial and therapeutic interventions remain essential. Antidepressants don't work instantly by making someone happy, and they don't work overnight. Instead, they help the brain communicate more effectively. For us to understand how they work, first you need to know that brain cells talk to each other using neurotransmitters or monoamines like serotonin, norepinephrine, and dopamine. In depression, these neurotransmitters are dysregulated. Specifically, these three brain chemicals are all decreased, especially in brain areas that control mood, stress, and emotions. And that is the problem that antidepressants target. They work by keeping these chemicals active for longer in the brain, so messages between nerve cells are clearer and more stable. This helps calm overactive stress signals and strengthen mood-regulating pathways. Antidepressants work by inhibiting the reuptake of monoamines, inhibiting monoamine metabolism, and modulating postsynaptic receptor sensitivity. Even though the chemicals increase quickly, people don't feel better right away. That's because the brain needs time to adjust and rewire itself. Over a few weeks, antidepressants help brain cells become more flexible and resilient. This process is called neuroplasticity. Antidepressants are classified based on their mechanism of action on brain chemical regulation, specifically which neurotransmitters they affect and how they increase their availability in the synapse. Antidepressants fall into 5 categories, such as SSRIs, SNRIs, TCAs, MAOIs, and atypical or second-generation antidepressants. Let's talk about first your SSRI, or selective serotonin reuptake inhibitors. Common drug names include fluoxetine, sertraline, citalopram, escitalopram, and paroxetine. So how do they work? SSRIs selectively inhibit serotonin reuptake at the presynaptic neuron, increasing serotonin availability in the synaptic cleft. Because SSRIs affect only serotonin, SSRIs have fewer and less dangerous side effects compared to other antidepressants. They are considered first-line treatment because they offer the best balance of effectiveness and safety. We can remember their side effects using the acronym SSRI. S stands for sexual dysfunction, decreased libido, delayed orgasm, inability to achieve orgasm, erectile dysfunction. This is a common board exam concept. You have to explain to the patient that this is a reversible side effect. Another S is stomach upset, which includes nausea, diarrhea, and other gastrointestinal disturbances. R is for restlessness. There will be initial anxiety, agitation, nervousness. This is due to the surge in energy, especially early in the treatment. And the last letter stands for insomnia and headache. As SSRIs cause sleep disturbances, they are best given in the morning. Headaches are treated with analgesic agents. As nurses, it is our responsibility to inform the patient that these drugs have a delayed onset of about 2 to 3 weeks. SSRI should not be stopped suddenly because doing so can cause SSRI discontinuation syndrome. Also avoid alcohol as they can increase sedation, risk for falls, and accidents. They may also worsen depressive symptoms. A key nursing knowledge that you have to remember is that the suicide risk is highest in the first to the third week of antidepressant treatment. During this time, the patient's energy will be increased while the patient's mood is still low. At this stage, patients may still feel hopeless, but now have more energy to act on their suicidal thoughts. This concept is applicable on all other antidepressants as well. Now let us talk about drug-to-drug interactions. Patients who are on SSRIs should not be given other serotonin-increasing agents such as other antidepressants, triptans, tramadol, linezolid, St. John's wort, dextromethorphan. Combining SSRI and other serotonergic agents will cause serotonergic crisis or serotonin syndrome, which is characterized by the following: confusion and agitation, rigidity and hyperreflexia, increased vital signs and autonomic activity, shivering, tremors, incoordination, seizures, and eventually comatose. Nursing management includes stopping serotonergic medications as a priority action and providing supportive care based on the patient's manifestations. Now let us talk about SNRIs, or serotonin norepinephrine reuptake inhibitors. Common drug names include venlafaxine, desvenlafaxine, duloxetine. These antidepressants work by inhibiting the reuptake of both serotonin and norepinephrine, and we can remember their side effects with the drug name itself. S stands for sweating, N is for nausea, R is for raised blood pressure or hypertension. That is why SNRIs are contraindicated for patients with uncontrolled hypertension. And the last letter is also insomnia. Remember, any drug that can cause insomnia are best given in the morning. And as nurses, it is our responsibility to educate the patient about not discontinuing SNRIs abruptly, as they can cause severe withdrawal symptoms. Also instruct them to monitor their blood pressure. Now let us talk about drug-to-drug interactions. Patients who are on SNRI should not be given serotonergic agents. As I've mentioned, this can lead to serotonin syndrome. They should also avoid sympathomimetics such as epinephrine or adrenaline, decongestants, ADHD medications, asthma inhalers, caffeine, or cocaine. Combining SSRI with any of these substances can give the patient a double or even a triple whammy of norepinephrine activity. This can overwhelm their system, leading to dangerously high heart rate and severe hypertension that risks causing a stroke, organ damage, or even a heart attack. And now we go to TCAs, or tricyclic antidepressants. Common drug names include amitriptyline, imipramine, nortriptyline. TCAs block the reuptake of serotonin and norepinephrine. But unlike SSRIs and SSRIs, TCAs are not selective. In addition to blocking serotonin and norepinephrine reuptake, they also block histamine receptors, acetylcholine receptors, alpha-adrenergic receptors, and calcium channel. This lack of selectivity explains why TCAs are considered as the most potent antidepressant, but they also cause more side effects. Now let us talk about their side effects. Due to the blockade of acetylcholine receptors, patient may experience anticholinergic side effects such as blurred vision. You have to implement fall precautions, instruct the patient to avoid driving or operating machines. D is for dry mouth. Adequate fluid intake and good oral hygiene is key in managing this symptom. Sugar-free candy or ice chips may also be helpful. Urinary retention. Patients should be taught to void regularly and report difficulty urinating. Constipation. As nurses, you have to promote high-fiber diet, fluids and activity, and also monitor bowel movements regularly. Tachycardia or increased heart rate. We have to monitor their vital signs regularly. Blockade of histamine receptors causes increased appetite, therefore weight gain. They can also cause sedation. That is why TCAs are best given at night. And clients should absolutely avoid alcohol to avoid oversedation. Alpha receptors help maintain vascular tone. This vascular tone helps maintain our blood pressure. Blocking these receptors causes cardiovascular and blood pressure effects, such as orthostatic hypotension, which can lead to reflex tachycardia, or even syncope or fainting. Educate your patient to change positions slowly. The nursing priority here is risk for falls. Cardiotoxicity is the most dangerous side effect of TCAs. They can cause arrhythmias and sudden cardiac death in overdose. The drug of choice for TCA toxicity is physostigmine or antilirium. Now let us talk about the contraindications of TCAs. It should be avoided in patients with cardiac diseases and those patients who have a high suicide risk, because TCAs are lethal in overdose. Now let us talk about monoamine oxidase inhibitors. Common drug names include phenylcypromine, phenelzine, and isocarboxacid. Before we discuss the mechanism of action of MAOIs or MAOIs, let us talk about monoamine oxidase first. Monoamine oxidase is an enzyme that breaks down monoamine neurotransmitters such as serotonin, norepinephrine, and dopamine. Therefore, the mechanism of action of monoamine oxidase inhibitors, as the name says, is that they inhibit monoamine oxidase. In other words, they prevent the breakdown of serotonin and norepinephrine. So what are their side effects? The first one is mental slowing. MAOIs depress central nervous system activity, leading to sedation, reduced alertness, and slowed thinking. Nurses should warn patients about driving, operating machinery, and alcohol use. They can also cause appetite increase. These drugs may increase appetite and cravings, leading to gradual weight gain. Weight monitoring and nutritional guidance is crucial. Orthostatic hypotension. Teach your patient to slowly change position and monitor their blood pressure, lying, sitting, and standing. Intimacy issues. These drugs may cause decreased libido, delayed orgasm, or erectile dysfunction, which can reduce adherence if not addressed. Patients who are taking monoamine oxidase inhibitors should avoid tyramine-rich foods. These foods are usually aged, such as cheddar, blue, and Parmesan cheese. Fermented, such as kimchi, sauerkraut, soy sauce, and miso. Cured or smoked meat, such as salami, pepperoni, and sausages. Spoiled foods, and overripe fruits. In addition, patients should also avoid alcohol, especially red wine and tap beer. This is a critical information since if patients on MAOI consumed a tyramine-rich food, it can lead to a medical emergency called hypertensive crisis, which is the sudden, severe, and dangerous elevation in blood pressure that can cause acute organ damage and is considered a medical emergency. Likewise, MAOI should not be taken together with other antidepressants such as SNRIs, SSRIs, and TCAs, as this can also result in a hypertensive crisis. In order to prevent hypertensive crisis, a washout period is required. This is the waiting time between stopping one medication and starting another, allowing the first drug to be fully cleared from the body. So, for example, the patient is currently taking any of these 3 antidepressants, and we would like to switch to MAOI. The patient should first stop his current antidepressants, wait for 2 weeks, and start MAOI. This is also the case when switching from MAOI to an SSRI, SNRI, or a TCA. Stop first the MAOI, wait for 2 weeks, and then start SNRI, SNRI, or TCA. An exception to this rule is fluoxetine, an example of SSRI, because of its longer half-life, meaning it stays longer in the body. A washout period of 5 to 6 weeks is required. The last are the atypical or second-generation antidepressants. These antidepressants are for symptom-targeted treatment, meaning they are chosen based on the symptom profile of the patient. Specifically, mirtazapine is given for the depressed patient with insomnia and weight loss, as it improves sleep and appetite. Bupropion for patients with fatigue and sexual dysfunction, because it causes no sexual dysfunction and it is non-sedative. And lastly, trazodone for those patients with sleep disturbance due to its sedative effect. That wraps up antidepressants. Remember, these medications take time to take effect. Patient education and careful nursing monitoring is crucial. Master the mechanisms, know the side effects, and you'll be ready for both exams and real-life patient care. Feel free to watch the videos over and over until you master them like a true nursing ninja. Thank you for watching Lance, lectures about nursing concepts and examinations. Keep learning, and I'll see you in the next lecture.